Hi and welcome. Let's look at the indications for uterine myoma screw in obstetrics and gynecology. So a uterine myoma screw is also called a corkscrew or traction screw. It is a gynecologic surgical instrument used to grasp and apply traction to uterine fibroids or the uterus during surgery. So this is a picture of a uterine myoma screw, also known as a traction screw. So, what are the indications for use of a uterine myoma screw? First is myomectomy. It is used here to grasp and apply traction on a fibroid during open/abdominal myomectomy and laparoscopic myomectomy. This facilitates enucleation of intramural or subserosal fibroids by improving exposure and control. It is also indicated in difficult uterine manipulation. When the uterus is bulky, enlarged, or firm, for example in multiple fibroids, making handling difficult with forceps alone. Provides firm traction without excessive crushing of tissue. It is also indicated in total or subtotal hysterectomy. This is used to pull the uterus upwards or laterally during abdominal hysterectomy or laparoscopic hysterectomy. It is especially useful in fibroid uterus where size limits visibility and access. It is indicated also in deeply embedded or large fibroids. It allows controlled traction on large intramural myomas to assist dissection from the myometrium. It helps reduce operative time and blood loss by improving surgical planes. It is also indicated in minimally invasive gynecologic surgery, used in laparoscopy to maintain traction through small ports and avoid repeated grasping and tissue trauma. So let's briefly look at the contraindications like caution taken when using a uterine myoma screw. Very friable tissue. When used on very friable tissue, there is risk of tearing. When used in suspected malignancy, there is risk of tissue dissemination. It is used with care to avoid uterine perforation or excessive bleeding. So we'll be looking at some MCQs on a uterine myoma screw. A. It is used during cesarean section, which is false. B. It is used during vaginal hysterectomy, which is false. It is used for destructive operation, which is false. The cervix should be fully dilated before it is used, which is false. Injury to the ureters may follow the use of this instrument, which is false. In the next slide, we'll be looking at why these questions are all false. So, A, it is used during cesarean sections, which is false because myoma screws are not used in cesarean section. B, it is used during vaginal hysterectomy, which is false. Uterine myoma screws are used mainly in abdominal procedures and not vaginal hysterectomy. C, it is used for destructive operation, which is false. Destructive obstetric operations use instruments like craniolas and perforators, not myoma screws. The cervix should be fully dilated before it is used, which is false. The instrument is applied abdominally to the uterus or fibroid. Cervical dilation is irrelevant. E. Injury to the ureters may follow the use of this instrument, which is also false because the myoma screw itself does not directly endanger the ureters. Ureteric injury is more related to clamping or litigation during hysterectomy. So, in a nutshell, myoma screw is used for traction. It's a traction instrument for fibroids/uterus during abdominal surgery, not an obstetric or vaginal instrument. Thanks for listening. Do not forget to like, subscribe, and share if you found this video useful.